It's a very warm welcome to you. Welcome to the Lamelle Health Pod Talk. In this episode, we are digging deeper into polycystic ovarian syndrome. I've got Karen back with me, and we're just going to look at some of those other physiological elements that really speak to the personal, your self-esteem, your sense of confidence, and just feeling feminine, and also just dabbling a lot more into fertility issues around PCOS. We know that a lot of the narrative around PCOS is this big fear that you might never be able to have children. And we've got a beautiful lived experience, a story of hope that Sammy is going to share with us. Thank you for trusting us, Sammy, with your story. Just to remind you that you're not alone, and there's so many ways to go about having a full life, including being a mom. Imagine that. But also the elephant in the room, the white elephant in the room, where PCOS is just covered with a plethora of shameful nuances and stories, and people don't want you to talk about it. Why do you have to feel like you have to suffer silently? And we're just going to unpack that as well. So welcome, ladies. Thank you so much for joining me.
Thank you.
Thank you very much.
I think I want to start with this femininity, because Lamelle as a brand also is focused on empowering, the contemporary woman and making her feel whole and strong and sexy. And some of the symptoms that express, themselves as PCOS can take away from that confidence. I want us to start talking about acne, for instance. We spoke offline, Karen, that there's a difference between just normal acne and PCOS acne. Can you just talk us through that?
So we talk about acne as mild to moderate inflammatory or inflammatory, and it's not necessarily what it looks like or the process that is different in PCOS. It's just that it is so resistant. It's resistant to whatever we do to the skin. So in my experience, where I worked in the skincare environment, moving with my feet into pharma as well, we would very often pick up females that have PCOS because they would be in a skincare unit and they would have tried everything. So they would start in the pharmacy with a scrub and a lotion. They would do the whole benzoyl peroxide route. They would, in many cases, and it depends on their pathway, they would either land up at the doctor and go on to antibiotics and benzoyl peroxide once again. They might go to Roaccutane at a stage, and then they come off the Roaccutane and the pigmentation, or isotretinoin is the chemical name. They would go on to isotretinoin, which is, of course, all the Accutanes, Roaccutane. They would see improvement maybe while they're on the medication, have severe side effects, come off it, and then their acne would just come back again. They would land up at skincare therapists. Skincare therapists would do hectic chemical peels and do laser treatments and put them on every product on her shelf. And it's like, it just doesn't budge. It just goes nowhere. And maybe that path takes you 5 or 6 or 7 or 10 years. And then someone goes, do you menstruate regularly? And it's like, no, I never have. I just thought it was normal. It just comes and goes. And you go, but you're in your 20s, probably started menstruating when you were 13, and it's not regular, and you've got acne. Maybe you have PCOS. And what drives that acne is male hormone. So, and that links into the whole feeling of femininity, is that you, in the first place, your skin looks terrible. You've got these big pimples. It's sore. It's
uncomfortable.
It's uncomfortable physically. And then it's uncomfortable when you're looking at that person as well. And she feels uncomfortable when she looks in the mirror. And the male hormones also drive you to start, your body form can actually change. So we don't form the hips and you don't have the curviness. In some cases, some women with PCOS don't have the curviness. And then they might grow some hair on their faces. But back to the acne, it's just a process that really takes long and takes passion and takes someone committing to going, maybe you have a challenge that we need to handle. And if you don't manage the PCOS, it's very difficult to manage the acne.
Sure.
So we then start looking at lifestyle. We then start looking at managing the insulin resistance. And of course, then the knock-on effect onto the male hormone. When we can lower the male hormones, the treatments become more successful. Still doesn't mean that we necessarily will have clear skin. It might mean that we clear skin, but in some cases, that pathway it's been so long that your patient now has scarring. And then we have to manage the scarring as well. So it's nearly, I nearly want to say it's your face and your soul that gets scarred through this syndrome.
Absolutely.
And it's something that if we are educating and if we're educating our skincare professionals, we could treat much faster and help much quicker and keep that skin nice and clear much quicker.
It's a waiting game, but it's not impossible.
No, definitely not.
And I mean, you spoke about the acne part of things, and of course how it affects people from a self-esteem perspective as well. And you mentioned hair
growth.
like the hair growth, like because of that testosterone again. So I really want us to hone into this femininity thing, because a lot of the symptoms really do present themselves as things that take away from that feeling of feeling like a woman or feeling sexy and beautiful even. So let's talk about the facial hair in particular, the chest hair, the excessive hair growth, but even baldness, because baldness is also associated with being manly. It's okay to be a Joshua Doll when you're a guy.
Joshua Doll.
You know, everyone's favorite uncle. But
okay, of course.
But
I always call them roll-ons.
Oh, they do look like roll-ons. Oh goodness. But do you know what I mean? But those are, a man can rock his baldness, and no one's going to say, oh, you bald. You know, what's wrong with you? So let's talk about the hair issues from a hair loss perspective and even the excessive growth part.
Okay, so insulin resistance causes the follicles not to form properly and they don't pop and release an ovum. But in that process, there's also fluctuation of hormones, and that fluctuation of hormones controls our male hormones. It also has an effect on a little carrier. So in our bodies, it's nearly like if you could think about there's a little motor car that carries testosterone to a certain place. And if the body needs it, it will release it so that it can link to a cell. Now that carrier gets lost. So we have a lot of free testosterone raving around our bodies, and it turns on all the testosterone, all the male switches on the cells. And that's what causes the hair growth. So in our hair follicles, we have these receptors that receive the male hormone. And basically, it just shows, so a male secondary sexual symptoms or signs, that cell then says, if there's free testosterone, oh, you must be a man, so you should have a beard. But if you're a woman, it doesn't have the determining effect to say, wait, this is not a man. It shouldn't have a beard. So the hair that comes out of that hair follicle is male hair. It's male terminal hair. It's a thick, hard hair. And it grows in the pattern where men would usually grow hair. So beard, mustache, on the neck. Women don't have hair on their neck because they don't have very many follicles on their necks. So it grows on your neck, on your chest, on your back. And I know that I saw a video once of this woman that had terrible hair growth on her back, and she couldn't wear strappy tops. She couldn't wear little dresses because this hair would show, and that takes away from your femininity. You have to go for constant treatments of this hair, and the treatments don't work very well. So we also pick up ladies who come for laser treatments continuously. We have within so many treatments, you should have a significant reduction in hair, and it doesn't happen. So we start then asking questions. How often do you menstruate? Always comes back to that question. So that, it's a very big challenge for females with PCOS. And then with regards to the balding, in our head, unfortunately, testosterone kills hair follicles.
Okay.
And that's why you see male balding. And that's why it's Joshua Doya, trumpet. You are more manly because you have so much testosterone, but it's not a good thing in females. So we see male pattern baldness. So you bald in the front of your head or bald on the top of your head. And that's a challenge, because if we can stop that, then the hair growth will happen again. But until you lower those testosterone levels, you're fighting a losing battle.
I like that, because I think patience is at the center of this. These are all manageable symptoms.
Yes.
But you've got to be self-compassionate.
Yeah.
And you've got to start that journey. It all starts with starting.
Yes.
And what would you say to somebody who's listening right now and they've seen some of these symptoms, and perhaps this is an opportunity, ladies, to ask yourself, when last did you have your period? How regular is it? Just question just your cycle and how it functions, and maybe go see someone, right, Karen? But for somebody who is experiencing that and they're like at the beginning of that, at the genesis of feeling like it's out of control, how do they begin that long but possible journey to feeling normal and feminine again?
So I would always suggest that you do go and see a medical professional. It's purely because I come from a medical field. It could be your GP. It could be, depends on which area you're in. So we do know that in our smaller cities and towns, there's not necessarily a gynae, or there are few endocrinologists. And your GP will be the go-to. So go to the GP. They might not need to do blood tests. They might just need to do a sonar. We only need to have 2 of the 3 symptoms. Irregular menstruation is one symptom, or no menstruation at all. The second symptom is the male pattern, that we see something that says there's too much free testosterone in your body. And the third symptom is that you have cysts on your ovaries. So those 3 are the tools that they use to diagnose. So you don't need to go and spend 7,000 Rand on blood tests. Though blood tests might be necessary if we find that the treatments aren't working. And then we know that 80% of women with PCOS have overt insulin resistance. So it's something we can pick up in their bloods. Of the 20% that don't, they actually do have insulin resistance, but it's very well hidden. So if you look at Sammy, for instance, she's tiny.
Yeah.
She's never picked up the weight, I don't think. So she
Clear
doesn't
skin.
look like, she's got clear skin. She doesn't look like someone that's got PCOS, but she's been diagnosed with PCOS. So we know that they have most people who have PCOS will have insulin resistance. So find a supplement. Myoinositol is easy. Ovaria is easy to get. It's in the pharmacy. Start drinking it. Start looking at your lifestyle.
Yeah.
If you don't have a medical professional you trust, go to your skincare person that you're going to and ask them to help you with a pathway. And just start treating and looking at being, look at your diet, look at the amount of sugar that you're taking. But I do think it's necessary to see a doctor about it, because it is something that we need to measure now, and then later on we need to maybe look at it again just to see how you're doing with regards to the insulin resistance as well.
And be kind to yourself in the journey. Be kind to yourself.
Absolutely.
You deserve the self-care, and you just also deserve the time to recover, I suppose, from this very confusing time, because it can be very confusing before you know what's happening to you, right? So we're speaking about the physical representations of this, and you mentioned that Sammy, who has PCOS, doesn't have the optics.
Yes.
You're right. That suggests that
typical symptoms.
she might have this, right? But there's this white elephant in the room. Those are the physical, obvious things that make a woman feel less than, and she just doesn't feel good about herself. But then there's the fertility side of things, and you've got a story to share on how that played out for you. And it's the hereditary part as well, Karen, like I said, touch on, because mom had PCOS,
my grandmother,
your grandmother, and then you.
Yeah.
Can you just talk us through that experience?
Of course. So for me, I never really divulged into menstruation conversations with my mom, and it wasn't a lack of knowledge or anything. It just, I don't know, you just didn't really speak about it. And I had then gone to a gynae who at the time diagnosed endometriosis. she then looked at me, and I've always had a bit of excess like blonde hair on my arms.
Okay.
And she pulled it and said, "Yep, you've got PCOS."
Whoa. Whoa.
And
Oh, thank you.
and I was like, "Okay, cool."
Mm. Care to enlighten me?
So I was 18. So you also, at that time, you don't know what that is. You don't know what PCOS is. You've never heard of it in your life. Endometriosis is one thing. And then, you kind of think they're related, and they're two completely different
Conditions.
conditions, in your body. So then had surgery to correct the endometriosis. They did ovarian drilling on my ovaries. And
At the age of 18.
at the age of 18.
Oh, Sammy.
Yeah. Mm-hmm.
But also, thank goodness for early detection.
Yeah,
right?
I know that's
Yes
good,
and
but that's
no.
traumatic,
Yes and no.
Traumatic for a
to go
teenager.
through
Yeah,
this.
and it was very quick. I remember I phoned my husband, who was my boyfriend at the time, and I said, "Look, I've just gone for this consult. I've got surgery in 3 weeks." And it was just like, bam, bam, bam. Like,
You have to go for the surgery.
have
No
to go,
other,
And
no
how
other
are you
options.
processing it? I'm thinking
I
just
never
as a
really
young
did.
18-year-old.
Even when I went in for my surgery, a bit of a long story. It was a bit of a botched procedure. They obviously do keyhole surgery. And the doctor at the time put the ports in too deep, and she went straight through me, essentially. So she severed blood vessels, my artery, she hit my spine. Yeah. So not knowing of these conditions and not knowing a lot about them, and then going into a botched surgery, I then woke up in ICU, and she said, "Well, sorry, my girl, it's no babies for you, and I think, the best option is a hysterectomy." And I still had no idea, what had been done, what stage of endometriosis is it, what is PCOS, is it something that you have one surgery and it's done, or, so that was kind of my introduction to these conditions, and it's not a great one either, because it's very traumatic. I then, obviously, you had to have conversations younger, knowing, okay, I might not be able to have children. So at 18, to obviously have the conversation of, I might not be able to have children. Is this something you want? Are we going to continue this relationship? And I can't promise you kids if you want kids. So it's a lot to take on very young. It's a lot to understand very young as well. Having two different conditions, to then also go to another doctor who wants to help you, because you've had one who's now done a botched surgery. And no one wanted to come near me after that. I went to several different gynaes afterwards, and my first doctor, who initially did a bit of a botched job with the op, she was quite well known and had been around for a long time. So a lot of the newer doctors had studied under her, and I completely understand you don't want to take that on, but also not knowing what you've got yourself is incredibly difficult. So for me, it was also just self-education and just trying to learn as much as I could. And yeah, it's been years and years. Yeah, it's been a journey. And yeah, I still get my cysts. But like I said, I didn't say yet. I've got two
babies.
kids.
Yes,
I've got two kids.
that's that's the silver lining for me. I
Mhm.
mean, so sorry for just that traumatic
Yeah.
backdrop, right? That brought you into awareness of your PCOS. But you went ahead and you stayed with your lovely partner,
I did.
and
Yeah.
you have two precious
Yeah.
babies. Can you just tell us about that just fertility process?
So fertility-wise, it's quite difficult because you've been told you're never going to have kids. So part of you really believes that. And I can sit here and say you have to have hope and faith and sing kumbaya. But when you're in it, that's not what you want to hear. You don't want to hear, be hopeful, it'll happen, because you really don't believe it, especially when you've been told by a doctor it's not going to happen. You really do start to believe it and think that is your future. So for us, I lost 2 pregnancies at first. before my eldest daughter was born. And I really did believe, like, that's it now. You know, she had said, I'm not having children, and this is it. It's come to life, and I'm not having. So I think it's also that headspace of, you know, actually believing it. And when I lost my first pregnancy, I thought, well, that's it. It's over. It's done. You know, I don't want to really look at adoption. For me, it wasn't an option. Surrogacy in this country is also a very
complex.
difficult road to go down. So, yeah, it was kind of like a hopeless spiral almost. So when you're in that, for someone to say, have hope, you know, it's really not what you want to hear. So we just, without medical
Interventions.
Yes. So we just kind of carried on and thought, you know what, if it happens, it happens. If not, then it's not in our hands. But
then you've accepted that as well.
Yeah.
I love the just the connection between your mental state and the outlook that you employ for yourself, and what it does in very miraculous ways for your body and how your body responds as well. Because you don't need to do anything other than just naturally try to have children. Just want to go back a little bit just on the 2 miscarriages.
Yes.
Was there any link to PCOS or fibroids or
Not that we
nothing at
know.
all?
Not that we know. I didn't go ahead with genetic testing. To me, that would give me answers which I can't do anything about.
Yeah.
So it wasn't something I wanted to fixate on, because it was something that affected me for a long time. When you think, okay, I'm pregnant, and I had multiple negative tests, but I knew I was pregnant, and it was a matter of going for blood tests, and they said you're pregnant, but it's not growing.
Oh man.
Yeah.
Thank you so much for sharing that, Tammy. I'm so proud of you and so happy for you.
Thank you.
I really love this whole mental thing. Like, just clear your head. Don't overthink it, because there can be an information overload. Karen, we were talking about it.
Absolute information overload. And you know, the thing with a placebo effect, so when we do trials, we talk about a placebo effect. So if I give you a sugar tablet, in some cases you will see an improvement in the condition we're treating because I'm giving you a sugar tablet. And that's mind over matter. Now it works in the opposite as well. Just because I told you this is not going to happen, if I believe strongly enough that it will and that this is something that I really want, we can actually change that.
Yeah.
And that is what makes medicine so interesting. So I know we all think that medicine is this exact science. Not so much.
Yeah.
All right. So there's data, there's research, and we work with the research. So having PCOS increases your risk for losing babies. It also increases your risk for gestational complications, diabetes, for instance. It does make it difficult to fall pregnant, but it doesn't mean that you cannot fall pregnant. And I mean, Sammy's a very good example of that. And she's got the most beautiful little girls that are really so sweet.
That's adorable.
So it is possible to live with the fact that you will have babies, you know.
If that's what you want, you know, and prepare yourself mentally, spiritually, emotionally, and physically.
If you let that get in your head and believe it, then that's what will be.
Believe it to receive it.
Yeah.
I want to talk about the hereditary part of it. And maybe you can share, Karen, some insight around that if you've got any. But I want to link that to the messaging in our households. We don't talk a lot about chronic illnesses or diseases and anything that we don't really understand. We just shove under the carpet. I'd like to get some insight from you on how that went with you were 3rd generation PCOS, and yet still you found yourself quite overwhelmed with the diagnosis.
Absolutely.
So what does that suggest about just the communication that we have in the family around some of these conditions?
I think especially for me having 2 girls, it has to be a conversation. It's a non-negotiable, whether it's endometriosis or PCOS. You know, there's a chance you'll have either of them. So for me, it's that education at home, but also the education that's out there, you know, in medical institutes. When I used to struggle a lot with cysts, I went through a period of having constant cysts, and the one was eventually roughly the size of a tennis ball. And what had happened was, Kari, you'll be able to give me the medical terminology, but when it's so heavy on your ovary flips over.
Yes, it's called torsion.
Yes.
Mhm.
Yes, and that can actually affect the blood flow to the ovary.
Yes.
Yeah.
Yeah. So that had happened.
Mm.
The cyst subsequently burst, and we went to hospital, and the doctor gave me.
Isn't that just
Yeah.
a generic
Sorry, I
painkiller?
think you should just
Yeah,
stay
what?
away from that.
So-
That's cramp medication.
For
Yes.
stomach cramps. So having been through that and seen like the lack of knowledge and the lack of
Yes.
explaining it to someone and
Mm.
what it is and what it entails, and that and won't help. So, you need something a bit more severe for that kind of pain. I really believe that we need to educate on it more.
We're very lucky to be in the place where we are now.
Yeah.
Because, I mean, if you think about your mom, the fact that it was a hidden condition,
Mhm.
it was something that you didn't tell anybody about. It was an absolute sentence. You were, and this is the challenges. So when we go and look at the data, 1 out of 10 women will have PCOS. How do we know that? Because the symptoms can be very mild.
Mm.
Because we look at fertility clinics, 50% of females that arrive at infertility clinics will have PCOS as the cause of their infertility.
Wow.
So PCOS, unfortunately, has been seen as a condition of infertility.
Okay. So that's where the shame stems from.
That's where the shame
It's kind of
stems
been
from.
dubbed as the.
It's dubbed as you will now, let's just start on doing, let's just harvest
forget
as
it.
many eggs as we can.
Yeah.
And let's just do IVFs because you're never going to fall pregnant naturally,
Mhm.
which is not what I would say is it's not everybody's truth.
Sure.
Absolutely.
Okay. So it's only in the last few years, I think, probably in the last 5 or 6.
Yeah. It's really come
maybe
to
5 or
light.
6 years. It's that short period of time that we've been openly talking about the fact that there is this condition called PCOS.
Yeah.
There is this condition that affects your fertility, but it also affects your life.
Yes.
And these are the ways in which it's going to affect your life. It has a high incidence among females. We don't know exactly what causes it. We do know there is some research looking at genetics, and there isn't a gene. But what happens is the fact that your hormones are stupidly all over the place while you are pregnant affects your female babies.
Okay.
So I'm sure there will be more research, and we will, because it's an area that's being very well researched at the moment. We will get more doors opening and we will get more information on it. But you do have a higher risk of having PCOS if your mom's
mother
had
had it.
PCOS. You also have a higher risk of having endometriosis. And so it's something that we should be talking about. And it's unfortunate that we're very well educated with regards to sex and safe sex. And, that happens from babies, inappropriate touching, that sexuality is spoken about a lot, but nobody teaches you on family planning, on your fertility road and your fertility education. There is no education on that. So it is only when I arrive at a destination, be it acne or skin or hair or I can't have a baby, that this condition is actually then spoken about and people know about it. But now, I think we're seeing more and more conversations on it and more education. Our doctors are better educated, our medical personnel is better educated. And things like what happened to Sammy and her landing in the hospital with a burst ovary. A burst cyst, not an ovary.
Burst.
If it was an ovary, she would have been in ICU as well. Again, second time. But that doesn't happen, guys.
Okay. That's good to know.
Yeah, that wouldn't happen. So when we say, I have PCOS, I have had a cyst, I think it has burst, can you please put up a drip with some really good painkillers?
Mm-hmm.
it should be happening.
It should. Okay.
Yeah.
All right. I love that you mentioned that in the past 5 to 6 years, there's been a growing momentum that shines the spotlight on PCOS.
Absolutely.
Thank goodness, I think also for social media and platforms such as this that Lamelle has created to create that community, which leads me, I guess, as we wrap up the conversation around that deep internal conversation you're having with yourself, you grappling with these issues because you've just been diagnosed with PCOS, or maybe through this conversation you just realize maybe you have symptoms that need medical attention to be sure what is really going on with you. How do we demystify these sad myths? How do we debunk some of these falsities around infertility and all of that? And shame, how do people feel like they are normal and they can lead a normal life with PCOS?
I think the biggest thing is to just give yourself grace.
Mm.
You know, to not have that placebo effect. Well, the doctor said, so this is it for me. It's done. Because once you're in that space, it's incredibly difficult to come out of it. And like Kari said, we've got more information. There's a lot more education out there. So instead of getting into a dark space with a negative sort of outlook on it, rather educate yourself, whether it's through a medical professional, whether it's the numerous sources of information that are out there on PCOS, and just, you know, take back your power and give yourself grace in the situation.
Self-compassion, self-love.
Yeah.
And I think formats like this is what we really are. And it's so important to be speaking. And also things change. Research changes, information changes. So don't get stuck on what was the last paper 20 years ago. And continue to ask. And I like the thing about if you don't like the answer, ask again, ask
Yeah.
someone else.
Yeah.
Get yourself educated and have a look at it. Don't just go, I've got PCOS, let's hide that book in the back of the cupboard until I really need to, manage it. Look at it and make sure that you're educated. And I like the fact that you said, how can I live a normal life? What is normal?
Again,
So
what is
this
normal?
is normal for me. This is normal. If I was a diabetic, what would be normal for me? It would be normal for me to have my insulin pump carrying around with me. It would be normal for me not to eat sugar. It would be normal for me. That's your normal. And I think we need to stop we also need to stop creating the Instagram life.
Absolutely.
It's not all curated.
The filter life.
It's dirty sometimes. It's messy. And there's grace in that.
Yeah.
And share and ask. And create communities where people can talk to each other about anything.
Yeah.
Just empower yourself with the information. I think that's so important because we fear what we don't know. But when you know, you feel so brave to actually just, charter a good path for yourself to wellness.
Definitely.
Ladies, thank you so much.
Thank
that was so
you.
beautiful
Thank
and
you.
encouraging. Thank you so much for tuning in.